We were hoping to, again, to give you some things to think about. We've been presenting these seminars for, I guess, since the law was passed back in 2010. And we're learning right along with you, and we're also trying to think of ways to present the information to you to also get you to be thinking in terms of what are the ramifications of this? What does this mean in my business? So we're hoping that this is bringing up some information for you to just process and take back with you. I don't know if you've seen this picture, but basically you can see two different women in this. Have y'all seen this before? Do y'all see the two women? Two different women. One of the women, if you look in terms of an older woman who's actually looking down, this is her face right here, this is her chin, this is the mouth, all right, an eye right here, and she's looking down. You see her?
Yeah.
An older woman, okay? Now, if you shift your view a little bit and look at a younger woman who's actually looking toward the side here, this is the kind of the back of her face. This is her nose. This is her eyelash here and eye and ear right here. You see that one? There's two different ones. All I really wanted to do with this was to tell you that what I'd like to do now is to have you kind of think outside the box. Maybe to think about things in a different perspective. Okay? Because the environment has changed so dramatically because of the things that Tracy's just talked about, you and your market segment may need to look at your renewal, at your current program, your benefits program for your employees in a different way. You need to maybe consider that there are other options that you didn't have before that are now a part of the picture. And that's what we want to take the next few moments to kind of discuss. And Tracy's already mentioned some things, but let me just reiterate how things have changed and what that means to us. What are the ramifications of this? Prior to the passage of the healthcare law, actually to 2014, because this was brought in phases. It passed back in 2010, in March of 2010, but it's been rolled out in phases. The biggest wave of changes occurred last January 1, as of this year. And that is in the individual market. Prior to 2014, in the individual marketplace, and that is when you go out and buy a product from Blue Cross or Kaiser or Humana as an individual or as a family, not through an employer-based program, through a group. Prior to 2014, you had medical underwriting. You could be approved or you could be denied if you had a health condition that was uninsurable. Or you could be rated up because your condition required more premium to be paid out. They could charge you 20-30% more than the average person. Or you may have something called a rider, where they would say, we'll cover everything but this condition for 2 years. Okay? That happened prior to 2014. You also had pre-existing conditions. On the Blue Cross application, it would tell you straight up, all right, if you get approved, you get accepted, we will not cover anything that you were treated for in the previous 12-month period until you've been covered on the plan for 12 months. Right? Anything brand new that happened, right away, you can cover immediately. But if it was because of a pre-existing condition, you didn't have coverage for that for 12 months, 24 months sometimes. Okay? You also did not have parity in the marketplace between what individual plans paid for and what group plans paid for. Your group plans, because it had to comply with more mandates, covered more things. For instance, if you wanted on December 1 of last year to buy a plan that covered normal maternity benefits in the individual marketplace, you couldn't get that product. You could not buy a plan that covered normal maternity benefits. Group plans covered that, but individual plans didn't. Another thing could be chiropractic, mental health benefits. They were not the same because individual plans were not required to pay for the same things that group plans pay for. And that's why sometimes your individual plans were less expensive. If you were healthy, you could probably get a pretty good rate in the individual marketplace, but it's because the plans didn't pay for the same stuff. Okay? You also had the case where, for the most part, you would pay for those premiums on an individual basis on an after-tax basis. Okay, with a group plan, you know, if your employer has a Section 125, which most of you probably do, which is a premium-only plan, you could allow the employees to pay their portion of the premium on a pre-tax basis. In other words, it would come out of their gross pay rather than their net pay. But if you buy an individual plan, you're always paying for it with already taxed dollars. Make sense? Okay? And that's prior to January 1 of this year. However, that's changed. There's a new reality. Now we have, instead of medical underwriting, we have guarantee issue in the individual marketplace. So regardless of whatever health conditions you've had in the past, you are not going to be turned down. You will get insurance, hands down. Okay? Automatically covered. The insurance company does not reserve the right to cherry pick. They have to take everybody who enrolls. You also have no pre-existing limitations. So if you have an individual who is diabetic, when they begin coverage on the plan, on the new individual plans, they're covered on the first day, even for that diabetic condition, because there is no pre-existing limitations. Okay? In the individual plan market, now the products have to cover the same things. Okay, that maternity I was telling you about, it wasn't covered on the individual, now it is. Okay? So, when Tracy mentioned those essential health benefits, okay, they're a part of now the individual package as well. So the products now cover the same things. Now they may not cover them the same way, all right? You may have deductibles that will be different, you know, or certain limitations within the policy themselves, but the covered expenses are now the same for individual and group, where that was not the case before. This happened to you last time. What's going on here? Sorry about that. All right. You still do pay with after-tax dollars, so that's not changed in the individual marketplace. There was something that we were experimenting with, or as a market or as an industry. We were talking about something called a premium reimbursement arrangement, where we could set up for a company the ability to give pre-tax dollars to their employees where they could go out and buy their own insurance. But that was basically shot down by the IRS last year. So they're not allowing that. So this is still the case that if you go into the individual market, you're always going to pay for it with after-tax dollars. Okay. Now, another thing, and I think Tracy may have mentioned this, maybe just referred to it, but now there are only certain enrollment dates on your individual plans. See, prior to 2014, if I wanted on November 1st, if I wanted on June 1st, or on March 12th, if I wanted to go in and get an individual policy, I could do that. That's not the case anymore. There are enrollment periods, basically November 15th or so to the end of the year, that you have the ability to buy that coverage, which will be effective on January 1. Now, the exceptions to that rule would be special enrollments that occur because of qualifying events. All right, so if there is a loss of coverage, or if a dependent child drops off of their parents' policy because they've now turned them over to 26, you know, because you can only get coverage up to 20. Those types of things where you have a loss of coverage, some kind of event that triggers that loss, that would allow you to go into the individual marketplace off of the open enrollment periods and buy coverage. But you have to incur or have a qualifying event for that to happen. All right, so we have now gone beyond the deadline. Remember, the administration said you had to get coverage in place by March 31st or enroll by March 31st. Matter of fact, they said, if you were listening to the articles or the radio, they said if you even initiated the process on March 31st but couldn't get it completed because of all the problems with the website, that's now concluded. Okay. For the rest of the year, until you open up to the new open enrollment at the end of the year, you can't get individual coverage in the individual marketplace. And it's because of that fact of saying, because you have this issue right here now, what they're doing that for is to prevent people from gaming the system. Of saying, you know, I'm not going to get coverage until I get sick. Okay? You can't do that anymore. So if you do decide I'm not going to have health insurance this year, and then you develop a terrible medical condition, you're going to be blocked out until the next enrollment, at which time you can get in. But you just can't get in anytime you want to now. All right? So these are the changes that have occurred in the individual marketplace. Okay? Just to give you an idea, as we talk about the marketplace, you've heard the terminology an exchange, okay? It used to be known as an exchange. It's more now referred to as a marketplace. But when we talk about that, there's actually more than one exchange that we're really referring to. When you talk about the public exchange, or the public marketplace, this is the one where the government themselves have been a part of establishing. When the law first came out, it basically allowed each state to make a decision on whether or not they were going to have the federal government run their state's exchange. The state itself would run its own exchange, or there would be some kind of partnership between the two. And all this is just a marketplace. It's a place where people can go buy health insurance. Okay, we were among about 26 states as Georgia that decided to default to the federal government running our exchange. Now that doesn't mean that we have U.S. government insurance, Uncle Sam Insurance Company. We're still in a marketplace that is made up of 5 different private insurance companies. Okay, it's just the government has been the one responsible for putting it all together. All right, and these are the 5 carriers right now this year that are participating in that public marketplace, public exchange. That is the one that's put together by the federal government. Those are Humana, Alliant, which is more up in the east part of the state, northwest. Peach State, which is Peach Care, mostly for the kids. Kaiser and Blue Cross. The main 3 here are getting most of the business: Blue Cross, Humana, and Kaiser. And as a matter of fact, because of the way that they file their rates, Humana is head and shoulders above the other 2, the other 4 for that matter. They have really filed some very aggressive rates. Whether or not that's going to hold up, it's going to yet to be seen. But right now, Humana is just, in this first year, has taken a big market share of these private or these public plans that have been written this year. There were other companies that looked at it: Aetna, Coventry, United Healthcare. All of them decided this year they were not going to participate in the public exchange, the one that's put together by the federal government. Okay.
When would they have the option of changing those particular carriers? When would that new carriers come in or carriers exit the marketplace?
I think it's the end of May is when the carriers themselves have to file their rates. So
that would be 2014?
That's right. Again? I think they're going to start making, they can't get in until next year.
Next year,
but they're having to make that decision pretty quickly. Okay. So whether or not these companies will decide to get in next year, we don't know yet. This marketplace probably will, it'll evolve. As the carriers, some of the carriers just said we're going to step back and take a look and see how this goes, before we decide to jump in.
So how long do you think it'll be before we'll find out? Like, would it be in time for our December 1st and January 1st renewals? Do we know who's coming in for 2015?
Yeah, I would think you would know by then.
Yeah,
you would have to, because they'd already have to have some preliminary information up and running on the websites that are posted. I don't know the exact date. Have you heard anything about that, Tracy, in terms of when?
I haven't, but by the time the renewals happen, if they're December or January, open enrollment would have already been opened. So we should probably know in November rates and all.
Yeah, it's going to have to be probably prior to September. I don't know between May and September when that announcement will come. All right. So you've got 5 vendors. Each of them are offering these different types of plans, as Tracy showed you in the previous slide: the platinum, the gold, the silver, and the bronze. There's also a plan designed for young individuals, or some that meet certain income thresholds, something called a catastrophic plan. But they all are offering among these products in their portfolio. The product choice is rather limited on the individual marketplace. Okay, it's not as broad as you might see in the group as Tracy was talking about. And then you have the subsidy application to the process involved. Now, when we talk about the public exchange, that is, that the government, the federal government, or the states themselves have created, there is the ability for those who have certain income thresholds to be able to get subsidized premiums. We talked about in the previous slide that one of the things you and I are paying for in our small group medical insurance premiums coming up this year is this health insurer fee, which right now is running about 3 to 4% of the overall premium. That fee is going to pay the subsidies for low-income individuals. Okay, and what it's defined as is if you have an income less than 400% of the federal poverty limit. Okay, now these are figures from last year. But basically, 4 times the federal poverty limit for a single person. This isn't adjusted for regionally yet. This is more of a national figure, but you can earn $45,960, almost $46,000 as a single person, or less than that, and get some level of subsidy. Now, when you get to that level, the subsidy is zero. It gets to zero at this point. So it's going to scale, and you probably won't see much of the subsidy unless you're in the 1.5 to 2.5 times. 1.5 times is at 17,235. 2.5 times federal poverty limit is at 28,725. All right. You talk about a 4-person family. A 4-person family, that figure is $94,200. Someone making that amount as a 4-person family, less than that, could qualify for some level of subsidy when they go into the public marketplace. Again, most of that won't occur unless you're in the the $35,000 range as a 4-person family to around $59,000.
So what is that, the minimum poverty threshold, what is that number with just the federal poverty?
It's a federally published scale based on what the federal poverty limit is. Now, the 100% of federal poverty limit is that 1 times federal. And I haven't given you this scale. It's available on the internet. You can just kind of look it up. But the laws have said that you can get a subsidy up to 4 times the federal poverty limit. Again, it scales, so you won't see much of it at that level. But that's what we're talking about when you go into the public exchange. And this is really going to be one of the main attractions of this kind of offer, is for someone to be able to have their premium subsidized, because it could be quite a bit less than it otherwise would be, because they're getting help from the government to pay for that. Okay. Now, and there is a subsidy application involved. In other words, you have to, when you go into that healthcare.gov website, you've got to put in your income information, and you've got to go through some pretty significant battery questions to be able to qualify for that subsidy. Okay. Now, what I wanted you to be aware of is that there are some reasons to have some caution about these plans. Okay? If you were to come to me, now again, I'm just going to be frank with you. If you were to come to me as a client, or as a friend, or as a family member, and you were to ask me, do you think I should go to the public marketplace to buy insurance? I would tell you no, because I have serious concerns with some of the coverage levels on these plans. Okay, now if you are an individual that just has to have a subsidized premium in order to afford coverage, or you have no coverage at all, then this is something you'll need to consider. But I want to make you aware of some of the caveats that really need to come into play as you analyze this as an individual. Okay. Number one is that they have taken cost-cutting measures in order to get the premiums where they need to be. The carriers, we've gone to all the meetings that Kaiser offers and Blue Cross. Went to a Blue Cross meeting a couple of weeks ago. They did Humana meetings. And they'll tell you straight up that they have made they've cut corners on these plans in order to make them cost-effective. Okay? One thing is that the networks are very narrow. Humana happens to have an HMO product. Matter of fact, most of the plans are HMO. In other words, you have to stay in their network to get any level of coverage at all, except for an emergency. Now, Humana's HMO network is Northside Hospital. That's it. Northside Hospital. All right, that's in that system, so it's Northside, Forsyth, and Fulton, and I guess the other hospitals, so those are the third one. But if you are outside that system, you have no coverage unless it's an emergency. All right, so if you go into these plans, you really want to be very careful to see, is my doctor on there? And that's what you're seeing in the news articles, is people are beginning to find out, I can't keep my doctor after all, can I? On these plans, because that's exactly right, you can't. You're going to be into a much more narrow network of providers. Matter of fact, we have a lady that's in this room back here that works with us. Her name's Janice Johnson. She has a personal friend of hers. This happened about 2 months ago, maybe. Her husband was driving her to Douglas General Hospital, Douglasville, with appendicitis. She was having an appendix attack. Her husband called the emergency room at that hospital saying, we're on the way. The person in the emergency room asked him, what coverage do you have? He says, we have that Obamacare. And they said, don't come here. We don't take that. Now, when push comes to shove, because our country requires hospitals to treat patients in emergencies, they would have had to take that. But it's very scary to know that that was something that an emergency room person told them. They told them to go to Tift County Hospital, an hour and a half away. She could have died. But that's what you're hearing. There are some providers in our country that are already coming out and saying, as practices, by the way, we don't take this insurance. Okay? Now, I'm not saying, again, that these are not appropriate plans for, there could be situations where, as long as you understand the network and you understand some of these other limitations, and because you need the help financially, these may be the plans you have to take. But I want you to know about some of the reasons why they're priced like they are. Okay? And why I wouldn't personally recommend them for someone who's asking for my recommendation. Another thing is the formularies are restricted. The formulary is another name for an approved list of drugs. Again, you're reading articles, you're seeing things on Herman Cain and things like that, where there are people that are understanding, oh, by the way, my life-saving medication is not on the formulary. The one that I've been taking the last several months, it's not covered anymore because it's a more restrictive covered list of drugs. Your drug might not be on that list.
No, I was just going to say, as much as you said Humana's the most competitive one, in the healthcare industry, they are our biggest nightmare with these plans.
Is that right?
And they are the biggest nightmare, and the poor patients come in and get treated for a $20,000 device, and 6 weeks later, Humana comes back and says, oh, sorry, we're not paying for it. You didn't jump through the right hoop. And even though we do everything we can to guide them correctly, there is no way to understand these policies. They intentionally make it difficult. And I do not think they feel like they're saving any money when they get that big bill at the end.
Yeah. And again, and that's another thing is that when you look at the plans themselves on the website, the deductibles are enormous, very, very high. The out-of-pocket expenses are very, very high. If you are not going to get a subsidized premium, it's not going to be a deal for you. If you're comparing between individual and group-based coverage to an employer plan, it's not going to be a good deal.
And it's a killer for a healthcare provider that actually wants to provide decent healthcare to somebody, because in the end, they're going to provide the healthcare, and knowing that the patient can't actually afford what they're going to be left with as the balance. So who's going to eat that?
Yeah.
I mean, somebody has to in the end, and it's a nightmare.
These plans, the out-of-pocket expenses are much larger than what you've been grown to be accustomed to up to this point in time. The products themselves that we mentioned are limited. The government right now, they went through several committee meetings, subcommittee meetings, where they were asking Secretary Sebelius and some of her staff. And they made no bones about the fact that this website at healthcare.gov is not secure. Now think about the implications of that. You are providing it's very sensitive medical information relative to your personal history, as well as your income information. And all that is on a site that is not secure. And they admit that, which is scary. Okay? That's not been fixed to our knowledge, and probably won't be for several months, if ever. We don't know that. No subsidies are available if the employer plan meets certain criteria. Now, this is something that you all probably are aware of, that last October, this was a model notice that I know we provided to our customers. Now, you probably had access. This is available on the internet as well. This was a notice that you were required to give to your employees as of last October. And by the way, you may not be aware of this, but this is something you have to give to every new employee as well. You do that. Every new employee should be receiving this model notice. And what this notice is it basically is informing them about the exchange. Okay? And there are a couple of very, very important things that it tells them as an employee. It says, Mr. or Mrs. Employee, if your employer provides a medical plan that meets 2 criteria, all right, those criteria are these. Number 1, they don't make you as an employee pay more than 9.5% of your household income for single coverage That's not family, that's not single parent, that's not couple, that's single employee-only coverage. For the cheapest level of coverage option that your employer provides that meets the second criteria, which is it would be expected to pay the bronze level, that 60% level of coverage. If your employer provides a plan that meets those two criteria, two things happen to you. Number one, whatever your employer was contributing toward your health insurance, maybe the 50% of cost or 80% of whatever the employer, that contribution the employer was making for the coverage, you forfeit that. In other words, you can't just say, Mr. Employer, can I take that money and go buy myself on the exchange of what I want? You lose that. It's gone. Okay. Number two, you lose the government subsidy. Because your employer, this is what the notice tells them, because the employer has basically provided an affordable plan for you. You have the ability, if you want to opt out of that and go do your own thing. But if you do that, you are on your own. You have no assistance from your employer. You have no assistance from the government. When you go through these websites, it's going to ask you this question. Does your employer provide a plan that meets these criteria? If you say yes, it says, by the way, you have no subsidy. And it's going to quote you the total premium, not a subsidized premium. Okay? So we're creating basically a new dynamic, okay, that could be posed by this. And what I mean by that is, let me just kind of get into it and kind of give you an idea what I'm going to get at here. Before the Affordable Care Act, you might have had a scenario where you're looking at one employer who offers a salary package that includes a group health insurance plan, all right, where the employer pays some toward the premium, versus a company that doesn't offer health insurance, okay, cool office, that earns $60,400. But over here, the overall compensation is $60,400, but some of that includes the health insurance help they're getting from their employer, okay? So the compensation package here is the same in terms of the overall figure, but the employer is helping out with the health insurance. It'll be tax-free, right? So whatever the employer is paying to the employee in the form of a benefit for the health insurance, that's not a taxable benefit. It's nice, okay? And also on the other side, whatever the employee is paying toward the premium is being done through pre-tax section 125. Okay, that's nice, okay? And you also have guaranteed coverage because the group marketplace, again, guaranteed. Over here, if the guy has an issue with a maternity or a diabetic condition, he might not be able to get insurance because he's having to buy it on his own. Okay, you can get certain cyber services such as maternity. Okay, and then an employee who's looking at two employers might say this is looking really attractive. Okay, even though I'm getting less in terms of overall salary, when you look at the overall compensation package, I like it better with employer A. Okay, here's my taxable income. You see how this works out? The employer is putting this much toward the coverage. Now the overall health insurance premium in this example is the same for both people, but the employer is paying this much of it. Okay, and the employee is paying that much of it pre-tax. So when you consider all the taxable implication, this employee takes home about $39,000. This one takes home about $37,000. It's better, all right? When you consider the scenario, that's before Obamacare. Okay. Now after Obamacare, remember, because of the slide we went over at the very beginning with along my part of the presentation, health insurance now is guaranteed issue. Okay, so some things are different now. Right now, then, again, we have the same thing over here, but now the individual can get all this coverage, and he may also be able to get help from the government to subsidize his premium based on his income and the fact that he has 2 children and a spouse. So now look at the scenario. Okay? Same thing we had from before, taxable income. But now, this particular individual, because of where he is on that federal poverty limit scale, can actually get the government paying $9,500 of his premium. Okay? And then the employee pays the difference, again, after tax. But when you put all that together, now, see the difference? There's the new dynamic. All right? Now, I feel it's incumbent upon me to tell you that this is a scenario that's now been created. While I still wouldn't recommend the subsidized plans, because as I look at them, they're inferior plans. You're still going to have employees that are looking this, and now they're thinking, which employee, you could create a situation where an employer or an employee, potential employee, is looking at one company that offers group health insurance and one that doesn't. If the employer that offers group health insurance offers an affordable plan, all right, he knocks that employee, that potential employee, out of the subsidy the government would give him. Remember how we said that? That's what this notice tells him. Okay? That's why you're also beginning to see some companies make some strategic decisions. You know, you heard UPS, what has it been, 6 months ago or so, that said they're no longer going to cover spouses on their plan. In other words, they're saying spouses are not eligible members under their health plan anymore. Why did they do that? Well, I think part of it was a financial decision, but another part of it was, if you make spouses ineligible, not saying you can cover them if you want to, just saying you're not able to cover your spouse, then if you're a family that has a scenario where you meet the income limits of the subsidy, the spouse can go out in the marketplace and get a plan that's subsidized. Okay? If you do allow spouses to be covered on the plan, even though they're not choosing to, if the employer provides an affordable plan, the subsidy is not available to any member of the family. See that? Okay? That's why I think UPS made that decision, and why some are considering that. If you have a workforce that has a high level of maybe blue collar or lower income, where they could benefit from the subsidy, you might find that as a strategy you could employ to prevent them from having a disadvantage of being on a group plan rather than an advantage. See, that's the new dynamic that's at play now that you didn't have to think about before. Okay. Now, once again, I'm trying to temper this. I'm trying to be balanced, because again, I don't know that the public options are still the best options to have when you're going to be concerned about whether an emergency when you tell you whether or not to come here. Okay, I'm concerned about that. But you also have employees that are looking at the bottom line and may need help, may need assistance. And these are things you may just want to consider or have on your radar. We don't know how much of this dynamic is going to change the marketplace. That's something we're trying to keep a pulse on, and something you want to be thinking about as well. Does that make sense? You kind of see where we're having, this is a new perspective. This is something we hadn't had to think about before. But now we need to consider. Okay? All right. I wanted to make you aware that and I've been talking about public exchange. And remember, we said exchange is nothing more than a name for a marketplace. In other words, a place that you can go to buy health insurance. We have a private exchange. All right? It's at www.BurnettBenefitExchange.com. And I'm just going to show you if I have the ability here to get into it. This is our website. Okay? At that same website, you can actually go into this website and click on health insurance. This will work. And major medical. And you plug in a few details. Actually, it's going to give you the ability to talk to a call center. All right? But you can plug in your zip code here, individual family plans, child-only plans. You can plug in just your demographic data, and it will provide rates for private plans with not only those 3 major carriers, Humana and Kaiser Blue Cross, but also all of the other carriers that are participating in the private individual marketplace, which includes Golden Rule, which is United Healthcare's individual plans, Assurant, Aetna, Coventry, those other plans. Okay. And they're not going to have some of the same restrictions. Some of them will. Some of them will have more restricted networks. But they're going to be more private plans. And we also, by the way, have access on our website to the subsidized plans. But our site is secure. Okay? So we could get you those plans, or your employees, those plans that are subsidized, if that's the need. Matter of fact, some of you have employees that, because they're part-time nature, I mean, they're not eligible for your insurance plan, okay? So the affordable arrangement I was telling you about with this notice, that doesn't apply to them, okay? So they can, you could recommend to them our website to go to buy those individual plans, whether the public subsidized plans or the private plans, they can get that coverage on our website. Now be aware, because we now have gone outside the open enrollment. You can't just give them our website to go in and buy insurance unless they've had a qualifying event now, until we open up the new open enrollment at the end of the year for 2015. But we just want you to be aware that we offer a private version that is secure and not only includes the public options, but private options as well. And if you saw on the homepage, we also have other products that we can provide to your employees if they want life insurance, dental insurance, vision, those types of things they can buy there as well on an individual basis. Okay.
Monty, do you want to note on that how we can customize it for a company? A link?
Oh yes, we can do something called we can brand it. In other words, let's just say you want to get out of the insurance business. Okay, you want to instead decide you want to give basically a stipend to every employee and let them go buy their own insurance. I'm just on the insurance business anymore because the individual marketplace does allow for guaranteed insurability. You don't have to be concerned about somebody who is uninsurable not being able to get insurance. Okay. Now, what we could do is we could basically create a website like this that instead of having our address up here, it would have your address. It could be ProCare Benefit Exchange, whatever that might be. Okay, and you could actually say that individual employees can buy their coverage on our exchange, on our marketplace. It's a very small, it's like a $39 a month fee to do that. It's just not very hard at all. Now, if you give the stipend to your employees, be aware that that is now taxable income. It's not now. Okay? And you also forfeit the ability to allow them to pay their premiums on a pre-tax basis, which if you have a Section 125 document now, you allow them to do. Okay? So that's the flip side. Okay? You can set up that thing I mentioned earlier, that thing called a premium reimbursement arrangement. You can set up a PRA which says, we're going to create a PRA for our employer company. We're going to give everybody $300 a month. Okay? And they can go out and buy that individual coverage on their own with that $300. That's taxable income. Okay? Now you could say you can only use that $300 for health insurance. Okay? Or they can use it for dental insurance or whatever they want to. But they just can't use it to go out and buy a motorcycle payment with it, that kind of thing. You can designate it as something to apply toward benefits.
And how do you verify that?
The PRA arrangement that we set up with you will administer that so that it cannot be taken advantage of.
You can't have enough to say if you can work out with that. There's no way to integrate that process.
There's no way to make it, that give it the tax benefit that you get with a group policy.
Right.
Okay? And again, if you're talking about individual premiums, what we've tried to mention is that you may want to consider this if you're a smaller company. If you want to get out of the insurance business, this could be a viable alternative for you to think about. Okay? What you're giving, it used to be that there was a lot of differences, as we talked about, between individual group, and now there's parity. The one big difference is that tax advantage. On the group side, you can still provide tax-free benefits. Whatever the employer is paying for the coverage is not a taxable benefit to the employee. And with a Section 125, the premiums that the employee pays of the portion is done on a pre-tax basis. Those are still advantages that are exclusive to the group market.
Do you have any calculators by any chance on there, or anything that shows the difference, or that we could use to calculate the difference?
It's not consistent
Okay.
with everybody. It's going to be totally demographically driven. Okay? Because again, there's no underwriting on either one of these now. Okay? Makes sense? Just some extra things to think about, a different perspective. all right? Another perspective that you may want to consider at the size group that you are, as we mentioned in the introduction, is self-funding, okay? Now, self-funding maybe presents this picture of, oh no, I'm going to pay my own claims. And to an extent, yes, but you have several protections that are involved in self-funding, okay? The current way that it's being done is kind of illustrated here with this graph. These are all fixed costs. In other words, when you make your payment to Humana, Blue Cross, Aetna, Covery, whomever, every month, you pay the same premium every month as long as the same people are covered, regardless of what claims are paid out of that premium, right? I mean, you don't get, it doesn't vary from month to month. These are all fixed. But inside that premium dollar that you pay them are components that go toward administration. In other words, the people that are actually paying the claims, and your agent that's representing the plan to you, and those types of things. You have risk pooling, where you're trying to, pool dollars together from all the other companies, carrier employers that are buying this plan with you. You've got claims experience, actual claims things being paid out, claims expenses. You have premium taxes that you're paying to the state of all that premium, okay? You have required benefits and you have overhead profit built in there, all right, that they pay their employees in terms of the actual profit, all right? Now, if you go to the self-insurance arena, you have the same components, but you now have you can view all these. They're working, and you can see how the fixed costs are really a smaller piece of the puzzle. You're still going to have to pay the administrative fees that go toward the adjudication of claims, okay? Then you have something called stop-loss premiums. There are three different protections that you have that you're buying, where you don't pay all the claims yourself, okay? One of them is called a specific stop-loss. The insurance company will define for you within your plan that you will not pay more than a certain dollar amount for one claim. So you have a premature child, or you have a transplant, something like that. They may say, your plan will not be responsible for more than, I'll just throw a figure out, $25,000, all right? Anything beyond that, you're buying insurance where that picks up and takes over. Okay, that's a specific. You also have something called an aggregate stop loss, which is a combination of all the claims that your entire group can have up to a certain cap every year. And that might be, let's say, $300,000 for your group. If your group has a terrible year, you will be, in this situation, not required to pay more than $300,000. And at that point, the aggregate stop loss or insurance kicks in and takes care of the rest. Okay? The third protection is basically taking that aggregate and dividing it by 12 increments every month. In other words, you can't have that terrible, terrible, terrible month at the very beginning of the year and lose all of your cash flow advantage. They cut that into 12 increments, so you can't be responsible for anything more than 1/12 of that at a time. All right? So that's what happens in self-funding. Now, the potential savings are, if you have a very healthy group, and remember, we mentioned with Tracy's part of the presentation that we can't do any underwriting anymore. It's all guarantee issue. In other words, everything's demographically based. And we mentioned how the healthier groups are probably going to be trended higher because they've been benefited by the current structure. The current structure allows healthy groups to pay less for their insurance than the non-healthy. The new scenario doesn't allow that. With self-funding, the healthier groups, because the claim expense might be a lot less, will be able to keep the margin. All right? You don't have to pay that much out. So the healthier groups could see that this will be an advantage to them. All right? So you have the same components. You participate in your claim experience. In other words, if you have a good year, all that premium dollar hasn't gone to the insurance company. You've been able to keep some of that yourself. Okay? And you have the protection we talked about. You save on the taxes because the premium taxes don't figure on this component now. You're not paying premium taxes on that. So you're saving that. You're also saving on the health insurer fee that we talked about. The one that's paying toward the subsidies. You don't pay that fee in a self-insurance plan. That 3 to 4% of premium that you're paying on the fully insured plan, you don't pay that on the self-insured plan. Okay? The group size requirements are dropping. It used to be you wouldn't look at this until you had like 100 employees. They're now doing this all the way down to 10 employees. I don't know if that's still viable yet. I think in the 25 to 35 range probably would be viable. But they're making these products available to good companies. Now, I would say it still is a good thing to consider if your group is healthy. If you know of some major things going on in your group, this is probably not going to be a good solution for you. Because the risk that you take up here, normally these plans could be upwards of 10 or 10% higher than a fully insured premium. Okay, because there's some risk sharing involved. All right. There's greater design flexibility because you don't have to fall within those gold, silver, bronze, platinum, that the small groups have. These plans don't have those thresholds, those requirements. Now, some of the fees that we mentioned, it does require a certain bit of discipline. Okay, if you are on a partially self-funded plan, where now your fully insured premium is the same every month regardless of what plans you might have, if you have a partially self-funded plan, you're going to see your premiums do this. You'll go along, you'll have some good months, and then you'll have a spike, and you'll have a high month, and you come back down. It'll do this. All right. So if you have a true partially self-funded plan, you'll see that variation throughout the year because your claims are variable throughout the year. Now, there are some products called level funded. This is becoming the more prevalent products of the day, where they kind of level that out for you. In other words, they will give you a premium that kind of looks like a fully insured premium. But it's basically based on the worst case. And at the end of the year, when they've had an allowance for the claims to get paid out for when they were incurred during your plan year, you'll have a divvy up period. If you've had a good year, they'll give you that money back. If you've had a bad year, you've already paid for the premium protection that those stop loss protections we already talked about. So if you're not comfortable with that roller coaster ride, these level funded products are going to be much more viable. If you're a healthy group, this is something that we might want to talk about this year. Because as you see the rates that you're going to get with the new adjusted community rated plans that you'll have at renewal, you're going to see the increases you're going to be taking because of some of those trends that we've talked about. You may find that a partially self-funded plan will be more viable for you. Okay? That maybe you haven't considered before. Mention it again. Probably not a good idea if you have a lot of claims exposure.
Or a small group, if it's small, it doesn't make sense.
If it's a mini group, that's under 10 lives, not option right now. I wouldn't even, to me, I'm a little uncomfortable still doing that under probably 20 or 25. I'm not saying it can't be done. I'm just saying I'd like to see a little bit more of a track record to see how those things are working out. I think it's very viable at 25 and above, if you have a healthy group. Okay? This is the last slide here. Basically, we just wanted to bring these things to your attention because part of what Tracy mentioned before is there's this dynamic going on where we have so many companies now renewing at the end of the year. It may make sense for you to think about reviewing these things for your group right away, right now. You are not locked in to the anniversary date that you have. Okay? If you do find that it may make more sense for you now to go into the adjusted community rating plans ahead of time. Or maybe look at the individual marketplace, or look at the a partial self-funded arrangement right now rather than wait till December 1 when your renewal is. You can do that. Now you have to have plenty of advance notice. The new law requires more advance notice to communicate these changes if you're making an off-anniversary change. So I mean, we do have to have a little more advance notice to do this. But it may make sense to look at some of this right away, or at least quicker than we did before, to get out ahead of the game. Because you're going to be in the same ballpark with so many other clients who are renewing at the same time. Okay. Does anybody have any questions or comments? We're kind of going to come to a close in terms of all the information we wanted to present. Does anybody have any questions or feedback or? Matt?
If you chose to take an early renewal again, say July or whatever, is it my understanding that, there's a good possibility you'll see better rates now than what, we're locked into rates now until December 14. Is it a good possibility you see better rates before
It
December,
depends.
does that make sense?
And again, it's not a pat answer I can give you. It really has to do a lot with the demographics of your group. We've typically seen that the companies that are the younger groups, the healthier groups, the more preferred industries, the white collar industries, are the ones that are going to be, it's going to be a disadvantage rate-wise to go into the new adjusted community rate plans, because again, they're trying to train you, they're trying to make things more uniform.
A 3-to-1 ratio, right?
Exactly. And those types of things are probably going to work against a company with those types of criteria. The older groups, higher female content, not as healthy groups, the more hazardous industries. When you put those factors together, those might be better off under the adjusted community rate. But you realize too that not every company has all 4 of those or all 3 of those. You've got a mixture. So there are a lot of different things coming into play to figure out whether the new adjusted community rates would be better for you or not as good. So the carriers tried to give us a little bit of a heads up to say, we think these particular groups within your overall block of business might be benefited by staying under the old system. And we took that information and came to you all and said, the carriers have said, you all probably would be better off early renewing December to stay on the old system as long as you possibly could. All right? We found that some of those have not always been the case. We found that maybe that wasn't as good an estimation as they told us it was. Okay? So again, it may be time, if you wanted us to go ahead and begin to provide some analysis for your group right away, we stand ready to do that. And that's part of the reason why we want to meet with you. If you find that it's mutually beneficial, for your company to do something right away because it makes sense financially, it also helps us. I mean, to be honest with you, we're trying to figure out ways that we can best serve our clients. And we want to, if we can help some of you prior to this big rush that's going to happen at the end of the year, we'd love to be able to do that because we want to try to make it as smooth as possible a process as we can. But only if it's mutually beneficial. We're not wanting to push you to anything that doesn't make sense for you. We just thought it might make sense to look at it right away. And if that's the case, let us know and we can get started. We have some survey forms. If you would just take just a moment and give us some feedback to let us know if this information has been helpful to you, or if you would like to see something different, we'd love to have that. And we do have the certificates back here in the back that we have printed up for you, for those of you who wanted to get these. And we thank you for your presence here today, and hopefully it's been beneficial to you. Okay, thanks a lot.